So now as we come to the population which we want to treat and tackle, which includes the poorly controlled or the uncontrolled patients with uncontrolled diabetes, how would you approach this issue with the patient, that you have uncontrolled diabetes, and whether the surgery will be effective and how effective it will be? So do you have a scoring system by which you can tell the patient that, okay, if you undergo the surgery, then the chance of you getting completely means going in complete remission or getting a complete cure is so much, and the chance of you getting a resolution of just so many percent or whatever, that you might not be completely free of medication, you will still have to take one or two medication. So what is how will you tell patient about the prognosis of the surgery or the surgical option?
So once we collect all the medical information, a detailed history and an examination, and we do some tests. These are blood tests to see what is the status of the pancreatic cells which secrete insulin, and to see what is their response to glucose. So this can be done in a laboratory, and once we have the values of the test, then we can use a scoring system that we have, which according to these various factors which are to do with age, duration of diabetes, their weight, whether they are on insulin or not, how good their serum insulin secretion is and the responses of that, how well controlled or poorly controlled their HbA1c is. So these are all factors which will contribute to a score. Once you have the score, then people would know whether their diabetes falls in the mild group or the moderate group or the severe group. Then accordingly we would be able to advise them that yes, they can go ahead with surgery because it is definitely going to help them. If the factors are good, the cure and being free from diabetes should be lifelong for them. If their pancreatic cells are damaged a lot, then they might be helped to be free of diabetes for 5 years or 10 years, after which even if the diabetes is back, it will be very mild and can be controlled with just one pill or 2 pills. So even that is beneficial for them to avoid any side effects in future. So yes, these are various ways in which we can let our patients know that you will definitely have benefit from this surgery.
You mentioned insulin. Does the dose and the duration of insulin make any difference in the prognosis of the patient after the surgery?
Those who have been on insulin for many more years, if the doses are high and the duration has been long, we have to rule out that the pancreatic cells are not completely burnt out. If they are burnt out, then we may refuse to do the surgery because it will not help them. But as long as the pancreatic cells are functioning, then it won't be a problem with any amount of duration or the dose of insulin.
So I think the point that we would like to get across is that the younger the patient and the earlier that the patient comes to seek a surgical option, the better is the prognosis that we would be able to give that patient.
That's right. Absolutely. Yeah, before there is extensive amount of damage on the pancreatic cells, they obviously are going to get a much better response, because this surgery and the hormones that it activates It will reactivate the pancreatic cells. It helps to then prevent further damage or death of the pancreatic cells, and so that will ensure that they have a good result which will last for a lifetime.
So, and probably even the other thing that I think we would like to emphasize is all the other doctors, all the rest of the medical professional who are coming in contact with such patients who have poorly controlled or uncontrolled diabetes, they should refer their patients earlier to seek a surgical option, because today we find that a very small percentage of patients who require the surgical option or who will do much better with surgery are not referred to get surgery done. So where is the resistance?
Yeah, what you're saying, Manoj, is very true, because what we find, we both find that in society and amongst all the physicians and colleagues, is that there is not probably a complete awareness of what exactly is available for these patients.